All right, good morning, everybody, and thank you for joining us today. My name is Rob Spicker with the Communications Department, and we're excited to be able to make the official announcement today about the beginning of a COVID-19 rapid testing program in our schools. Our guests are filling in behind me. Glad to have representatives from Lee Health, Golisano Children's Hospital, and the Lee County Commission, and the Florida Department of Health. So we thank you all for being here. Each will make a few short statements, and then we'll open it up for questions. So to get things started, let me first introduce the Superintendent of the School District of Lee County, Dr. Greg Atkins.
All right, thank you. Thank you, everyone, for coming. We are extremely grateful for the authentic community partnerships that we have here, that they have developed around really our rapid testing initiative. The manner in which we've come together really for the safety and the security of our students shows the steadfast commitment of our community partners. And I just have to tell you that the longer I'm in this job, the more I value the importance of these partnerships, but also I've come to realize how much our community partners truly care for the children of the school district of Lee County. Those partners are as follows: the Golisano Children's Hospital, Lee Health, Lee County, the Florida Department of Health, Lee County. And believe me, when you go through a pandemic with these partners, they are very, very reassuring to a superintendent that you definitely have helped trying to navigate this very, very difficult time. The U.S. Health and Human Services Department recently provided millions of rapid tests to be used by healthcare and long-term facilities and school districts across the country. Florida was allocated 6.4 million test kits. Our district received a total of 2,000 tests, equipped with everything you need to conduct a rapid COVID-19 test. In order for the district to conduct tests at the school sites, we needed a clinical laboratory improvement amendment, which is being provided by Lee Health. Our current guidance from the Florida Department of Education is that we test symptomatic staff and students. A dedicated team from the Golisano Children's Hospital staff will be assisting us with the testing. Yesterday, the County Commissioners of Lee County approved the use of CARES Act dollars to fund the labor and travel of the Golisano team to our school sites. Last night, our school board approved the MOU with Lee Health so we can implement the rapid testing at our school sites, and we expect testing to begin today at our schools. This cross-agency accomplishment demonstrates the power of the collective when it comes to making things happen and trying to keep our kids safe and healthy in our schools. With a holiday break literally next week, we know families are looking forward to celebrating. We urge you to take the advice of our healthcare professionals to keep you and your families healthy and safe. Now I'd like to introduce Dr. Lawrence Antonucci from Lee Health to say a few words. Dr. Antonucci.
Thanks, Dr. Atkins. Good morning, everybody. It's really a pleasure to be here. So our mission at Lee Health is to be a trusted partner, empowering healthier lives through care and compassion. And I can't think of a better example than what we're doing and why we're here today. This program will take great strides in being able to test children early so that we can get them isolated and slow down the spread of this virus. This virus is still here. And the only tools we have are the tools that we've been talking about for the past many, many months: social distancing, masking, and frequent hand washing. And then when someone is positive for the virus, to take them away from others so that they won't be able to spread it. So I really want to thank Dr. Atkins. I want to thank Commissioner Hammond for the great support that we've received from the County Commission. And I want to especially thank Alyssa Bostwick from Golisano Children's Hospital and Dr. Stephanie Stovall from the Children's Hospital. They set up the protocols, the procedures to make this work. The FDA approved the testing, they set the parameters, and then it was a matter of making sure that we followed those parameters for the safety of everyone involved. A great day for the children of Lee County, it really is, and it really shows what being true partners can be and what the power of community really means when people come together to solve a problem. So thank you, and thank you for having me here today.
Next, I'll welcome up Lee County Commissioner Brian Hammond to make a few remarks as well. Commissioner?
Rob, thank you very much. Dr. Atkins, thank you very much. And Dr. Antonucci, thank you as well. It is a privilege to be here today as a partner standing shoulder to shoulder with Lee Health and with the Lee County School District. There have been a lot of decisions since March when the pandemic first began that have been very tough. But I can say on behalf of the Lee County Board of County Commissioners that this decision was very easy. Taking time to partner with the school district and the health system to help get kids tested so that we can understand how this virus is moving through the school system and how to protect others from catching it was just a no-brainer for us. And so we're proud to be partners with that. On top of being a county commissioner, in fact, more importantly than being a county commissioner, I'm a father. I've got 2 beautiful children in schools here in Lee County, and I know exactly what you're going through, parents. And to the parents out there, I want to say that you're in control. You get the final say on if your child is going to be tested. And when you get that call and when you think about that, I mean, this is something that you'll get to make the decision. But the idea is if we can identify kids who are positive with this quicker, and then help get them out of the classroom quicker, and then maybe find out who they came in contact with that day quicker, we can stop this thing from spreading to even more people. So it's really something we're doing to try and help people be safer. Again, on behalf of the Board of County Commissioners, I want to thank our partners for doing such a great job through this trying time. And thank you all. We wish you a happy Thanksgiving and a very safe Thanksgiving.
All right, Commissioner, thanks. Next, I'm going to invite Nursing Services Coordinator for the school district, Beth Whipp, up here to the podium. She'll sort of walk you through how the testing program is going to work. Beth?
Thank you so much, Rob. So I wanted to just give you all an idea of our process that we're actually going to use in the schools. And as Dr. Atkins mentioned earlier, we have begun the testing. We've already had 3 tests so far this morning administered. So we are hitting the ground running and excited about that opportunity in our schools. So the process will begin in the school when a student is sent to our isolation room with symptoms. The clinic staff will then evaluate those symptoms, and we have a rubric that we are using to identify which symptoms are high risk. And then we will contact the parents to ask them to come and pick up their student from the school. And at that point, we will offer the test to the parent if they so choose to have their student tested. So parents do have to give permission, and they do have to sign a waiver in order for the student to be tested. The parent must also be present during the testing process, so they will be with their child at all times while we are testing. Once that test is administered, it takes about 15 minutes for us to get the results. And the Lee Health nurses and medical staff are the ones who will be administering the test to our students. So once that test has been administered, it will take about 15 minutes to get the results. Once we have the results, then we're able to move forward with the isolation of that student. If the test is positive, then we're able to react very quickly, notify the Department of Health, and then they can begin doing their contact tracing. So all of these efforts are put into place so that we're able to identify those positive students sooner, and our Department of Health is able to begin the contact tracing so that we can hopefully reduce the amount of exposures that are in our school setting. So that is our process that we are using right now. We will also continue to quarantine the students that are symptomatic, so that process will not change. They will still be sent home because they are symptomatic, and they will follow up with their healthcare provider for further guidance. Thank you.
Now let me introduce Jennifer Roth from the Florida Department of Health, Lee County.
Thank you so much. We just want to say thank you to the school board and the county and Lee Health for the partnerships we've had here. We are very excited about this process because, as Beth mentioned, we'll be able to identify cases even sooner, and that will allow us to implement our contact tracing immediately. It's hopeful then that we'll be able to identify contacts and get them out of school even more quickly so that we can reduce the amount of exposures happening among our students in schools. So that's really, the benefit of what the partnership here today is going to bring to us, and we're very excited to, help work with Lee Health in receiving those results. And then just, as people have mentioned, the holidays are coming up, so I would be remiss from the health department if I didn't make a plug for some healthy tips for the holidays. We are recommending that people try to reduce the amount of exposures they have over the holiday season. Staying at home with the people in your household and celebrating the holidays with the people you see every single day is really the lowest risk activity that you could participate in. It's great that we have so much technology now, so FaceTime, Zoom calls, Skype chats, whatever it is to check in with family members who might be in other parts of the state or country is really the best way to keep in contact with your relatives over this holiday season. And of course, it is flu season as well, and so I always like to make a plug. In addition to the Thanksgiving, you should also be thankful that you don't have flu. So please, if you have not already gotten a flu shot, we do recommend that. Should help reduce the burden of disease we're seeing within our communities and kind of keep everyone healthy and happy and safe this Thanksgiving so that we can all enjoy a happy, healthy Christmas as well.
So that concludes the prepared remarks. Everybody here is available to questions, so I'll allow to open it up to questions and direct it at who you'd like, and they'll come up and answer for you. So first question.
Mike Raimondi, NBC2. For whoever can answer this question, say if one of these three tests from earlier today, a student does test positive, how quickly will parents of kids at that same school be notified of that positive test?
Thank you for that question. I will take that one. So the hope is that we will be able to notify our parents the same day that we have been notified of the exposure. We do report the positive test to the Department of Health, so then they begin their contact tracing and start identifying students that were in the class with the student or other staff members that may have been exposed. So our plan is to be able to notify them the same day.
Just a follow-up. If they are notified, will parents be told if it's the grade of the students? Will there be specifics?
No. To keep the person's identity private and to protect the HIPAA laws, we do not identify whether it is a student or a staff member at this time. We just inform that there has been a case identified at the school. So part of the contact tracing with the Department of Health is to reach out to those students or staffs who were exposed, and so that's the Department of Health's responsibility to make those contacts and to let those families know.
Okay. So it wouldn't be a situation where, would you guys let some parents know, say if there were 3 positive tests in one day, would that number be told, or would it still just be a flat, there was a positive case?
It would just be a flat positive case, yeah, because we will continue to, the procedures that we use will be the same whether it's 1 case or it's 3 cases in a school. We would do our cleaning procedures, we would do our contact tracing, so that would continue to remain the same.
I'm Brianna Ross with Wink News. A lot of parents are concerned about their kids missing a significant amount of school, either due to being symptomatic but not having COVID-19 or having come in contact with somebody that has the virus but maybe they're testing negative. So how will this help keep some of those kids in school?
That's a great question. We have made amends for students who have to be quarantined. They're able to continue their learning and their education by connecting virtually. So that is an option that will continue. Our hope is that when we identify our positive cases and the contact tracing begins, those that are exposed are identified sooner, and those who do not need to quarantine are not quarantined unnecessarily.
Got it. So some of those kids that came in contact but tests negative, will they be able to come back to school sooner with this?
So we don't use testing as a measure to come back. We use the symptom method and also the exposure method. So if you're exposed, it's 14 days that you're quarantined. If you have symptoms or you test positive, it's 10 days. So we are not changing that process. We will continue using those guidelines.
Hello, Taylor Petras with Wink. I had a question for Ms. Roth regarding contact tracers with the Department of Health. Can you tell us how many contact tracers the Lee County Health Department has, and are they handling the cases that they have coming in right now?
Yeah, that's a great question. So we actually have about 50 people total dedicated to COVID response. That encompasses a whole range of activities. That includes our contact investigators. We break it down. We're people who are actually assigned cases to investigate. That's about 20 people. We also have people who then just make phone calls to the contacts to alert them. So sometimes people also call them contact tracers. We just call them all COVID response. And so we have, a certain number of people doing that. We have people who are making calls and receiving calls from the call center for people who have questions. We have people doing data entry and following up on all of these labs that are being reported to us as well. So about right now, we have, I would say, about 50 in-house doing that. And so we basically are able to scale up or scale down based on the number of cases we're seeing. And so that is what we are doing. We have actually cross-trained quite a few internal staff within the health department. So as more cases come in, we are able to assign them to people that we can pull from other departments internally. And additionally, the state of Florida has actually done a really great job of doing some funding with a team called Healthy Together. They are kind of a contracted source of contact tracers for us to send additional cases to. So if there's not enough people in-house that one day, we can send those cases to Healthy Together, and they can also do the contact tracing as well externally. And there's an app as well that'll be coming out within the next week or so, where people who are positive can actually do their contact tracing via the app. So all of that is coming into place. So exact numbers of contact tracers are kind of hard to pinpoint, because that's, whenever we have need additional help, we can outsource that to the Healthy Together, and we'll also be utilizing the app.
Have you had to outsource to the Healthy Together recently or in the past?
Yeah, we use them on a regular basis. For the most part, we actually try to get to, most of our cases every single day. We do a pretty good job. I think a good plug, though, for people is that we would like to make sure that if you are being tested, make sure you give your most recent up-to-date contact information. I will say we do a lot of calls, and we get a lot of voicemails, a lot of inability to leave messages, a lot of people who don't return our calls, a lot of people who think that we are spam. They don't know if they were real. I've had people personally tell me there's no way you could be the health department because it's Sunday night, and I know the government doesn't work on a Sunday night. So no, we work 7 days a week during contact tracing. So please, just another plug, if you see the phone call or you get a voicemail, please answer it, because we are doing our best to reach you.
Just another quick question for you, I guess, just kind of what's your message to people with seeing a little bit of a rise in cases right now?
At the end of the day, I always tell people, the only way to get COVID is if you are less than 6 feet from someone for more than 15 minutes. That's our definition of exposure. So if you are not able to, maintain social distancing in your everyday lives, sometimes there are situations where you're in a work or a school setting where you can't do that. Just make sure you're reducing your bubble as much as you can. So that's why we say, if you can't maintain social distancing in the workplace, given the nature of your job, maybe don't have extended holidays with, grandma or other high-risk people or individuals. So, that's really a rule of thumb. If you maintain 6 feet distance from everyone in your world, you'll have your own personal bubble. And so, wherever situation you are, people ask lots of times, give us a hard and fast number for gatherings, or how many people should be in a room together. Well, it's really dependent. Can you maintain 6 feet distance for more than 15 minutes? If you can't, then you probably have too many people in that room.
Kevin Smith from Fox 4. What is the protocol to get the ball rolling on his testing? I mean, is it through staff, student, parent?
So our process is, when we identify a student or a staff member in the school, Then if it's a student, then we obviously are contacting the parent to come and pick up the student because they are.
Whose call is it if the student is ill? I mean, could be a staff member? Can it be an educator or a
Yeah.
parent saying, I think he might be, symptomatic?
If it's a parent, then they should not be sending their student to school if they have symptoms. If a teacher or another staff member identifies a student, they're coughing, they have congestion, they're complaining of headaches, any of the COVID symptoms, then they're sent to the isolation room. So anyone in the school can identify a student that's ill and can send them for evaluation.
Good morning, Leslie Delaspore, Fox 4. You kind of answered the question, earlier, is this a plan to keep, more students safe in school? But also, is this the district's way of trying to bring kids back to school as, we head into the new year? Is this kind of, a way to just put parents and families at ease and let them know that, hey, school is safe and your kid will be safe coming to school?
Short answer to your question is yes. I think that it provides really us more information, provides the parent more information so we can make informed decisions. We can maneuver more quickly and make sure that the students who potentially are exposed are kept safe. So I think that all of this is put toward the effort of reducing the number of exposures that we have at the district level and kids in school. One of the things that I will want to say to all of you is that fortunately we have seen in schools very limited transmission. And I think that's because we've been able to react very quickly. Thank you to our partners, the Department of Health and all of our contact tracers, our staff down here in the school district. They have done an extraordinary job, our school principals, our teachers, with seating charts on buses, cafeterias, to make sure that we are isolating students and maintaining that social distance where we can. And I think that has really reduced transmission in our schools. So that I really feel good about. And just emphasizing to everyone, again, a lot of what we're seeing as a school district are these gatherings outside of school where these transmissions are occurring. So when you hear our healthcare professionals talk to that, I cannot emphasize that enough as an educator, that's where we see the most rapid spread of this. So if we can reduce that, then I think we can continue to see more of our kids back in school, because that's where really education works the best, is face-to-face.
Brianna Ross with Wink News again. Just to follow up to that, I know previously the district was saying that they believe most people were bringing the virus from home. There wasn't a whole lot of in-school transmission. And even though it may be limited now, how do you guys know that in-school transmission is happening, and kind of has it been increasing recently, or where did the shift happen between people were getting it at home and then people were transmitting it at school?
So the way that we're able to identify as best that we can, because we can't always know for sure where the transmission is occurring, but what we use is our data of those who have been identified as exposures, those who are identified as cases. We link those if there's any commonality. If we notice there's connections, then we can say that, potentially they could have been affected by this person. We're not seeing a lot of those connections related to students within the school classroom or within their team sports. So with all of that information, then we say that the exposure could have happened outside of school. So we're just not seeing those commonalities and those links between our students and our staff with positive cases and then those who are quarantined.
Maybe one more.
Okay, this question's going to be for Beth, I think, as well. So you were talking about the process of if students are showing symptoms, and if a teacher, notices that, they go to, your isolation center, and Lee Health kind of takes over from there. And you said that the parent has to be with the student through that testing process. What happens if a student is experiencing those symptoms right then and there, but you maybe don't get in contact with the parent, or the parent can't be there that day? What happens then?
So we are looking at the possibility of making the test available to those who potentially could not have the test done immediately at the school, potentially a day later or 2 days later. We are looking at that possibility. With our limited amount of tests that we have right now, we'll just have to see how long we have the test and, how far they stretch. We're hoping that they last a long time because that means we don't have a lot of symptomatic kids, but we are seeing an increase, so we anticipate that we may go through those tests quickly, so we'll just have to see working through that process.
When you say quickly, are you thinking like a couple months?
We hope. We have about 2,000 tests right now, so we have about 2,000 tests.
96,000 students.
Yeah.
All right, anybody else? Real quick.
Hello again, Leslie with Fox 4. Just a quick question. Can the district talk about how you guys are maybe going to tackle students who are asymptomatic? I know with this testing you mentioned, students have to show symptoms in order to receive the test, but what about those who are asymptomatic? Any thoughts on that?
So at this time, because we have a reduced number of tests, we are, with the advice of our healthcare providers in the community, we are just using them on our symptomatic students. If we are provided more tests in the future, we would definitely look at testing for those who maybe don't meet the criteria to be able to identify asymptomatic as well. But at this time, it is just symptomatic students and staff. Thank you.
Just to follow up on that, the DOE's recommendation for these testing is for those that are symptomatic. So they have to present the symptoms for the test to be provided. So we thank you all for coming. And if you need any other individual questions, we will try to get those answers. But as you heard, the tests are underway, and we appreciate you being here, helping letting our families know that this is an option available to them. Have a good afternoon.